My name is Angel Reed. This video is for surgical nursing, VTHT 2439, summer semester of 2020.
Okay.
You tell me when.
Good.
All right, so now I'm just gonna print a strip so we can evaluate it. You tell me when.
Good.
All right, so now I'm just gonna print a strip so we can evaluate it. Okay. So the first thing that we're gonna do is we're going to spray the area where we'll be putting our leads with alcohol. This is just going to kind of clean the skin off, give us a better reading. And this is actually the instructions that the manual has in them. And then from here, we're going to put a little bit of conducting gel on the areas as well. So we have our left side up. All of these indicate where to put the lead at. So this is left arm. Going to be putting it in the axillary area. And then the left leg and the inner thigh. Okay. And just as we're keeping the legs parallel to each other, we want to keep the leads parallel. So we've already got our EKG going. What we're looking at here is we're looking at the different waves. So it starts with the P, and then right here this complex goes into the QRS, and then right here we've got our T wave. So what the P and the T is it's going to be the rest. The first area in the complex is going to be the SA node, and then our second one is going to be the AV node. And in between here, what we want to see is we want to see about the same distance between our complexes. So this just indicates that there's a normal heart rate that's happening. If we were to see a lot of pauses in between or longer pauses, then that could indicate that our patient has an arrhythmia. So that can be normal to see in dogs. It is not normal in cats. So, and then right now I'm just going to print a strip, and you can kind of see it's reading his heart rate, which that's normal. And that shows that he's really pretty relaxed. He's not panting. If they're moving around a lot, panting, they're not in the proper placement, then that can interfere with our reading. So we need to take that into consideration. So just going to go ahead and print a strip. Go ahead and stop it really quick. So to make up an enema, if you're not going to use a commercial one, which times that you wouldn't want to use that is like in a small animal, cat or dog, because you don't want to mess up the electrolyte balance. But in a large dog, commercial enemas would be fine. So this is how we make it up manually. I just have lube. You could use some chlorhexidine soap too, but we're just going to, in water, place a generous amount and just mix it up in the water. You can take a red rubber catheter feeding tube or a polyurethane one. You do want to match it to the size of the dog. This actual size, this dog could probably take a little bit larger, but just for the sake of this video, this is what we're using. So I'm going to go ahead and open it. Let me pause it really quick. All right, so now we're going to take our syringe, and again, this is going to be at the doctor's discretion, the size of the animal, what milliliter they want the syringe to be. We're going to have to cut this red rubber catheter down. Okay, from here, we can actually draw up our solution. And now when actually placing it, you do want to add lube, a generous amount to the tip, and usually the animal is going to be in lateral recumbency. And once it's lubed up, you would insert the feeding tube into the rectum and then dispense your enema. I just wanted to state that with the Tonapen that we use, there is no anesthesia or calibration required. So we're going to be doing the Schirmer tear test, and this is just going to check tear production, make for sure there's no KCS, which is basically a lack of tears in the tear duct. I have 2 strips, one for each eye. So I'll be taking these out one at a time. And they are labeled. I have an R on this one, so I'll start with the right eye. I'm just going to push the end of it down a little bit so it fits in his lower lid better. And I'm just gonna take this and bring his lower lid out, place it in here, and then just have him close his eye. And what we're looking for is for it to hit 20 seconds, preferably before a minute. But we will be holding it in here for a full minute if it doesn't. And you can already see it's turning blue, so we're already getting some results. Good boy. All right, so we did make it to 20, so it was a little slow, but okay, go ahead and start. So now we're gonna do the same thing to the left eye. Again, I'm gonna bend it at the end and just take his lower lid, place the strip right there, hold his eye lid shut. So it is moving up. Hold on, buddy. Almost done. Okay, so we are at 20 now. I'm going to go ahead and take that out. I'll be recording the time for each eye and the results that we got. So now we're going to be using a Tonapen, and this is going to be measuring for high pressure or low pressure in the eye. So it's ready to go. So we're just going to hold his head flat, and I'm just going to press this button. Okay, it's giving me readings. Okay, Ellen, what is it doing? I think it was working. Okay. Okay, we're just trying to get 5 readings. Good boy. One more. Okay, so now I'll be writing down what the measurements are in his right eye. All are around 20/21, so that's in the normal range. Okay, if you go ahead and stop it. All right, so now we're going to do the same thing to the left eye. Okay, so I got 2 readings that time. 17 and 16. Okay. 20, 21. Okay, now I'll be documenting that as well. Go. So now this is the eye stain. You can do this one of 2 ways. You can either stick the strip inside here and then draw up your eye wash, or you can go ahead and just put some of the eye wash solution on the strip. It doesn't take much, and you're just going to touch the cornea. Okay. Now we're going to flush it out. Okay, buddy. You can see that yellow is coming out, so the stain did get in there properly. Just get that excess out. I know. There we go. I have my black light already warmed up. So I'm just going to turn the lights out, and just what I'm looking for is any ulcers in the eye. I want to pull that eyelid down, make for sure there's nothing under the conjunctiva. Okay, everything looks normal. Now I'm going to take this eye wash and just finish getting all this out. It's also good to inform the owners that there's a possibility that this could come out through the nasal cavity. So you definitely want to let them know that. So I will be recording that and letting the doctor know that I did not find any ulcerations in either eye. Okay, so in this video, I will be placing a pressor bandage. We just did a mastectomy on this girl, and the doctor just wants some pressure to be applied. So I have to wear my mask because we're under COVID restrictions at the time, so I'll try to talk as loud as I can. First, I will be placing some Telfa pads where the incision is. She is just waking up, so be making for sure that we're monitoring too as we go. And usually you're better to do this in a standing position, but we're just kind of making it work right now before she wakes completely up. So now I will go ahead and take my roll gauze . To roll this under, just again applying a little bit of pressure as I go. Okay. Go ahead and just pull her tube. I know, baby girl, I know. This incision goes back kind of far, so we're just gonna get as much as that Telfa pad in there as possible. I've already unrolled my vet wrap, so now we'll be doing a layer of that. Just gonna bring that down a little bit. Again, I'm putting it on there with a little pressure, but of course not enough to restrict my patient from breathing or moving. I'll just be doing one layer of this. Good. Okay, so now I'm just going to take my bandage scissors, just place that right there, and since she's a small girl and she's older, so she doesn't get around too well, we're just going to use 1-inch white tape. So just going to place some on the bandage and some on the skin. And again, pulling out more than what I need. I'm going to gently take my patient, wrap it around. Okay, and I just want to show that I can get one finger under there so we're not too tight. Doing the same thing right here. Just making for sure on this side that I'm getting on the skin some. Okay, and I just want to put one more right here just so I'm covering that whole end of the vet wrap. Okay. In this video, I'll be demonstrating how to apply a Robert Jones bandage. I have all my supplies. I have padded gauze, my bandage scissors, my tongue depressor, my 1/2-inch tape, vet wrap, and right here I have my conforming gauze. We'll be starting by placing the stirrups on our patient's leg. We're going to go at least halfway down the leg. Okay. We're going to go ahead and put our tongue depressor. I will be doing this on the other side as well. Okay, now I will be using my padded gauze, rolling away from the patient, not leaving the toes exposed. taking my stirrups. And this is just going to help make for sure that the bandage stays on. Okay, now I'll be taking my conform gauze. Around here twice. That wrap. I'll be making for sure to stretch this out a little bit before placing it on my patient, just so it doesn't constrict anything. Okay. Starting from the top. That wrap is going to stick to itself.
Go.
So in this video I will be getting a dental x-ray of the incisors. So this will be possibly get the canine on there too. We'll see. Just going to be getting my angle, which is with the incisors is going to be parallel. So all I can do is laugh about it. So now I'll be taking the x-ray. Everybody is far enough back.
Franklin's. Go.
Okay, so now I'll be taking my x-ray. Everybody is far enough back. They will not be affected by the rays. We'll wait for it to develop. Okay, so right here, this is what we're looking at, the incisors. You can see there's the split in the mandible. We've got the roots of the teeth up into the crown. So everything looks pretty healthy. After we do this, we'll be probing and then cleaning.
Go.
Okay, now I will be using the ultrasonic scaler to clean this tooth. Taking my gauze, I'm going to dab that blood off. So again, I will be keeping the flat surface down. I will not be using the tip. I only want to stay on each tooth for just a couple of seconds because I don't want to make the tooth too hot and again create any divots and damage my enamel. Trying to carefully get into any crevices. Go ahead. Okay, let me just this is just going to smooth out any grooves that were created during the ultrasonic scaling. So now I'll be demonstrating how to hand scale. I have my PPE on. I'm going to go ahead and do this canine. So I want to just stay flat with the tooth. Just working my way down. I don't want to create any more divots for the tartar to embed in. Okay. All right, so what we have here is we have dental care products that are highly recommended. Studies have shown that if you take care of your animal's mouth, you can extend their life up to 5 years. So super important, just cutting down on the amount of bacteria that is harboring in their mouth and swallowed. We can really protect a lot of their vital organs from just becoming insulted by the amount of bacteria that they're coming in contact with. So they do have kind of like a method. It's good to chew, better to rinse, and best to brush. So it kind of shows you there are different variations of what you can do. If you're going to brush, it is best to brush once a day because their tartar actually does accumulate a lot faster than ours does. So we have different things to use. A finger brush. You can actually start to use the finger brush and then graduate to an actual brush. This is a soft bristled brush, so it's kind of different than ours. Ours is more hard, so you do want to use one that's specific to animals. And right here we do have a toothpaste. So this is actually an enzymatic toothpaste, and how that works is it actually mixes with the saliva in their mouth, creates enzymes, and helps cut down on, again, the amount of calculus that is accumulating. They also make some that actually have tartar control that's more of your beef flavor. This is poultry. They come in different flavors for your animal. What we have right here is chlorhexidine rinse. You just squirt a dime size of this in the animal's mouth, and again, it kind of works the same way. It mixes around, so you don't need a large amount. It's just the fact that, you know, you're getting some in there, enough to mix around and just create a good environment that's not gonna, again, help to accumulate that tartar. So this also has zinc oxide in it that really helps to, it's really good to use any of this stuff once a day. And then this right here is more of a treat. This is actually beef hide, not raw hide, so it digests a little bit easier. This again has the enzymatic enzymes in it that work the same way as the rinse and the toothpaste. They also make some that actually have chlorhexidine impregnated into them, so that kind of goes a little bit further and actually helps with the bacteria more than just the enzymatic motion. Other things that I don't have in front of me are like a water additive that has xylitol in it. That's the same ingredient that is like in your gums. That at high doses it can be toxic, but in the minuscule amount in the water additive, it's not. It's actually beneficial, and that again has to be changed once a day, and it's like either a capful to a large water bowl or half a cap to a smaller water bowl. So all of these things are good to use if one fits your lifestyle better. You want to make it a habit to do. That's how you're going to be successful. And it's just super important to be taking care of their dental care. It not only cuts down on halitosis or stinky mouth, but it also benefits your animal and helps prolong their life and just gives them a good quality of life.